background on DMD to begin with. Duchenne muscular dystrophy, also known as DMD, is a disease that manifests primarily in boys at a very young age. It is one of the most severe types of muscular dystrophy with a 100% fatality rate, and patients tend to not live past their teens. DMD works by decreasing the ability of the muscle cell to perform work. This is through the loss of the dystrophin protein as a result of an error in the patient's DNA that then causes dystrophin to fail in binding to the dystrophin glycoprotein complex in the muscle cell's membrane. There are various methods used by healthcare professionals to determine whether a patient has DMD, such as muscle biopsies and tissue staining, genetic testing, and protein isolation. The main point of this video is to highlight the mental and social implications of DMD as it affects both the patients themselves and their close family. As a result, we have three main topics that we will be covering. Firstly, we will cover the issues of mental health in the community of patients with DMD. Secondly, we will take a look at the social implications of living with DMD from a patient's perspective. And lastly, we will be covering the importance of education for patients and how that can help lead to a positive outlook for their future.
Although we've primarily been discussing the physical and clinical implications of DMD in our course, we think it is also important to discuss the mental health aspects of DMD. About 1/3 of boys with DMD have learning disabilities affecting their verbal learning and memory. Some of these cases can be more severe than others. Boys with DMD also have a higher chance of having ADHD and internalizing disorders like anxiety. Patients with ADHD or anxiety may experience disadvantages in academic settings and may have difficulty interacting with peers and family members. This can quickly lead to a feeling of isolation from the people around them. Oftentimes, a lot of kids may think that the symptoms they experience from their anxiety and ADHD are just a part of their DMD, when in reality, they can be treated separately for those symptoms. Doctors believe that anxiety, ADHD, and the learning disabilities that afflict many DMD patients may be attributed to a decrease of dystrophin in the brain. If a child is suspected of having a cognitive disability, they can be referred to a neuropsychologist that will assess them. Either the special education program in their school system or a muscular dystrophy clinic can help see this through. Once a child has been diagnosed, their treatments can begin immediately. With these treatments, a patient can have improved quality of life and can learn to manage the symptoms of ADHD and anxiety disorders to reduce feelings of social isolation and emotional distress. In the next part of this video, we will take a look at the realities that DMD patients face in their daily lives.
Hello, my name is Ronnie and I have DMD. I want to utilize this part of the video to show you a tidbit of my perspective of DMD. Although I'm the one who has DMD, the disease impacts the loved ones around me as well, starting with my parents. My parents feel the guilt and burden of being responsible for my condition. Studies have shown that mothers primarily feel the guilt of passing on the lethal gene mutation responsible for DMD. This can lead to stages of denial, anger, anguish, anxiety, and guilt in the parents of the patient. When I escape the tensions of home, I encounter the burdens of society. When I go to school, the pace of learning feels too fast for me. Processing difficulties are also common in patients of DMD like me. I have problems with short-term verbal memory, language development, language comprehension, and expression. In addition, basic vocabulary is also less likely to be accentuated. I also have weakness in phonological awareness and processing, combined with the short-term verbal memory, which increases my chances for a learning disability. This is probably why the rate of dyslexia may be as high as 40% in boys with Duchenne. However, this does not mark my ability to do well in school. Boys not only with DMD but also other processing disorders can benefit from receiving small, concise pieces of information, both orally and in writing. Parents and teachers both find it helpful to check often for understanding and provide necessary cues to ensure follow-through. Although short-term memory is one of my weaknesses, visual memory and long-term memory are often very strong for boys like me with DMD. Parents and educators believe that they could use these strengths to develop effective interventions which can help me succeed in school. Aside from not being able to keep up with the pace of the classroom, I also find my body and its ableness changing over time. I find anxiety and worry when I have to transition into using a wheelchair or respirators due to the progression of my disease. In such time, what comforts me is the support from my significant others, which have helped me adjust to the new life that I have to live. When I was in the third grade, I started to gain an awareness of the impact the disease was having on my strength. What triggered my awareness was the fact that I could no longer just get out of bed. I now have to push myself up with my hands. My muscles have significantly weakened over time. I only came to understand the disease clearly when I stopped walking and became reliant on a wheelchair at the age of 8. The isolation caused by DMD occurs beyond the classroom. Outside of the classroom, the lack of accommodation causes another barrier between my peers and I. I began to feel the physical effects of DMD when I transitioned into utilizing a wheelchair. In fact, I'm not alone. 8 in 10 boys with DMD begin to use a wheelchair around the ages of 10 to 14. The use of a wheelchair reminds me of a particular instance in which I first encountered bullying. Looking back, I thought, they would have not bullied me if I did not have the disease. Why did I get this disease? We were kids in the third grade. We really didn't know anything. I think they bullied me because after they had helped me carry me in my wheelchair all the way up to the classroom on the second or third floor, I failed to say thank you, so they took offense. So they just said, "What the?" and bullied me. This was the most difficult for me. Education is a very important issue to my parents. When I was younger, my parents believed in early interventions for my speech and language delays, as well as occupational therapy, physical therapy, counseling, and socialization. As I got older, my parents started getting concerned with developing an appropriate individualized educational plan that would meet my particular needs. In all, they also highlighted the importance of homeschool cooperation. All this is very important, but in my opinion, I also think it's important to consider the social frameworks that need to be altered to better accept individuals like me with DMD as a pivotal aspect of society.
Education of patients with the disease, as mentioned previously, is extremely important, as it allows them to gain a fully rounded life despite any learning difficulties. Because of these learning difficulties, however, teaching these patients mostly works better in smaller settings. Attending school is shown to increase patients' quality of life, and occasionally DMD-affected patients continue to further their education, graduating from university, and eventually even getting jobs. I hope you have learned much about the social implications of this disease and how mental health can be impaired as a result. Education, despite these many difficulties, allows for these patients to have improved lives and is, as such, a vital aspect of living with this disease. Thank you for listening to us.